Well, my background is in urban planning, but I've never worked as an urban planner. I started doing health policy at NCSL and have continued in that area, where I am now the director of health policy and I'm in charge of the federal health issues that NCSL addresses. As you know, Illinois has a very large Medicaid budget gap to fill, bigger than a lot of other states, in fact, and it's very difficult to get real-time savings in the Medicaid program, and that is the challenge for the state of Illinois, is to find the funds to fill that gap. Every state has a Medicaid gap problem that was created out of the end of the stimulus funds that states were receiving as part of the economic downturn. When that ended on June 30th of last year, that created a huge gap in Medicaid funding for states, and every state has struggled to fill that gap. Well, I think what Illinois has done well is they've started looking at long-term issues regarding the Medicaid program and have some strategies for addressing the dual eligibles, people who receive Medicaid and Medicare, who use the bulk, who aren't the biggest population, but they take care of the bulk of the expenditures. So without addressing dual eligibles, you cannot really address the Medicaid problem, and Illinois does have a plan that they have in place to start looking at that. They're expanding managed care to better manage the care of people who have multiple chronic illnesses, who are also a costly population. So they're looking at some of the cost factors that keep the program in the red and trying to do something about that in the longer term. And in the shorter term, they're looking at what their options are, which are very stark and are very difficult because it involves cutting current services to in a very extensive way. Under current federal law, the state cannot cut eligibility at all, and so that really leaves cutting rates to providers and cutting benefits and services, and those are hard. I think when you look at the longer-term Medicaid program, Illinois is doing what other states are doing, looking at the dual eligibles, looking at coordinating care, using community resources to provide the services, and having an outcome-based reimbursement process as opposed to one that is built on volume. So it's not how many people you serve, but how well you're serving them that gets you paid.
Right.
And I think that those are things that other states are doing, and Illinois is taking a look at those strategies and trying to move forward on them, which is a long-term strategy. The complication for Illinois is that filling the short-term gap is going to be a very difficult challenge. I was very humbled to be invited, and as I told the members, I have great admiration and respect for legislators across the country, because I know how much time they put into their jobs. It's not a 9 to 5, it's a 24/7 job, and it's not always easy because there are hard decisions that have to be made, and I'm just happy to be a part of that family.